is Joyce Gibb, and thank you for being here today. The hormones, there's 150 hormones circulating throughout our body, and there's a nice orchestration of this symphony. And these hormones are mainly regulated by the pituitary gland, which sits at the base of your skull. And the exocrine glands, which are glands that are secreted, the pituitary, the thyroid, even glands in the small intestines, and your fat cells even produce hormones. All those produce hormones. So this is just a small part of my talk today of the 150 hormones that are present in the body. So there's definitely a feedback mechanism from your pituitary gland that regulates hormones up and down according to whatever's happening real time in your body. So what are some factors that can throw off your hormones? It can be depleted nutrients, aging, alcohol use, drug use. I see many guys that abuse steroids in their younger years when they were weightlifting that have really low testosterone now. They don't think about that back then when they're trying to build some muscle. And if you have sleep problems, if you have physical and emotional stress, those all affect how your hormones are excreted. So today I want to mainly talk about women and their menstrual cycle. So when puberty starts passing, then the female menstrual cycle starts. And basically all that is your estrogen and progesterone rise. And the endometrium, or the lining of the uterus, thickens. There's increased blood supply to that tissue. And that is making available the egg and the sperm that come together and implant into the uterine wall. If that implantation does not happen, then every month that uterine lining sheds, and that's called your cycle, your menses, or your period. So, and that happens, should be monthly that happens. Some women are very irregular, especially when they first start menstruating early on in the first year or so. So what happens during that menstrual cycle? You have increased bone mass and increased lean muscle mass. But even from the beginning, the hormones can be terribly disarray, and you can see some girls gain a lot of weight. And the luteinizing hormone, follicle stimulating hormone, that symphony sounds like rap music. So it's not a good symphony that can happen. So what happens in your 20s and 30s? You actually have your hormones are at your peak, and those peak hormones make you have a high sex drive, good libido, and that is actually what's needed for reproduction. Then in your 30s, those hormones start dropping just a little bit. You can see a little bit of mid-weight gain. The hips spread a little bit too. But that's still a very highly reproductive time. But in their teens and 20s, that is the peak time of reproduction. So if somebody doesn't want to get pregnant, then they need to take precautions for that. In your 40s, that's the transition year between childbearing and menopause, and that's called perimenopause. Some women start having these weird symptoms. They feel like they have anxiety. They feel like they just aren't their normal selves. They have spotting. They have bleeding. They have weight gain. Their emotions just go crazy. And they want to have control. And I see this all the time with women. I want to have control. What do you want me to do? My cycle's 28 days, then it's 12, and in between cycles. There's no rhyme or reason to it. But the one thing that I would say is that what I see frequently clinically is the people that take better care of themselves, they eat right, they exercise, they meditate or pray, they typically go through this time a lot better than other people. I can remember my mom when she was in her 40s and 50s, early 50s, late 40s, early 50s. We were talking at the dinner table. Somebody would say cow, and she would go run into the bedroom crying. We'd go drive in the car, and she'd be just irritated about anything, and we'd have to turn around and go home. So I can remember a few times where my mom did not tolerate menopause very well. But some women do a really good job. They're like, I hardly got any hot flashes. Those are typically the people, though, that really take good care of themselves. So self-care is most important. One thing I always say, if you hate your partner for 2 weeks out of every month, it's your hormones. It's not your partner. So keep that in mind, because that, the other 2 months are okay, and it's typically the 2 weeks before that menstrual cycle is when, or a couple days into it, is when people have the most trouble with having anxiety. One of my favorite things to treat is premenstrual dysmorphic disorder, or called PMDD, and that's when these hormones are all really messed up. You have really low progesterone, really high estrogen, so you're estrogen dominant, and they really feel outside their body. The women want to kill themselves. I mean, really, literally. They snap at everybody. Sometimes they get divorced because of all these years of having poor hormones. So that's one of my favorite things to treat, because basically in 1 month, you can have really reduced symptoms by increasing increasing progesterone and kind of lowering the estrogen with a supplement called I3C Complete that helps clear the estrogen through your liver through phase 1 detoxification. So, menopause is a hard time for some, better time for others. But if you do take good care of yourself, that is typically a good, people are a lot better. So I want to do a couple of things, and this was from this book, The Hormone Fix, and it's by Anna Kabecka. She's an OB-GYN, and it's really nice because this little chart kind of tells, what do hormones do? And this is just a couple examples. Irritability, increased estrogen, decreased progesterone, increased testosterone. What happens when you have muscular weakness? Decreased testosterone, decreased progesterone. What if you have hair thinning? That typically is increased testosterone, and more specifically androsterone, which increases 5-alpha DHT, and that's called dihydrotestosterone, but that's kind of technical. But basically, that is androsterone's 3 times more potent than testosterone itself, and they get acne, they get hair thinning here, hair growth on their face, and that's where you see some women that they actually need to shave because their testosterone or androsterone is really high. A couple other things are weight gain. That typically can be low progesterone. And as I think we talked about before, with the progesterone, that's the first hormone to decline through perimenopause. And that's a calming hormone. So that's why some women act crazy, because now the calming's gone and they're estrogen dominant. Then testosterone survives menopause. And that's typically a PMDD type picture. So I'd love to help you with your health and your journey to maintaining your hormones at a good rate. We do supplementation with bioidentical hormones here, and it's usually a cream that's applied twice a day. We test your hormones, see what the appropriate dose would be, and then stay on that a couple months, retest again, see how you feel, because it really is how you feel and not just the levels of the hormones as to what I go by. So I'd love to help you through these time periods in your life, and just give me a call. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.